name is Megan Onfray, and this is my husband, Nick. And the first thing I'm going to do is just share a little bit with you about my story. So in 2019, I suffered a basilar artery occlusion. And at that point in time, I was 40 years old. So I was very young for that type of stroke. Young for any stroke in that regard.
Megan was running in Riverside Park and collapsed and crawled to a bench where a passerby called 911 and summoned an ambulance. She was then taken to Mount Sinai Hospital where she received her diagnosis. And over the next 105 days, she bounced back and forth between the ICU and inpatient rehab as she developed substantially every complication in the book between seizures, pneumonia, bed sores, DVTs, pulmonary embolisms, MRSA as well, before finally being discharged out of rehab just before the COVID pandemic hit. We think of it as a very premature discharge to home. She still had a tracheostomy.
I came home in a hospital bed.
Came home in a hospital bed.
Right.
A PEG tube feeds.
I was totally not ready to come home, but they had transformed my ward into a COVID ward, so they kind of like kicked me out. And it was good to be home, but I shouldn't have been home, basically.
Maybe a smidge early, yes. So I became a do-it-yourself nurse, administering Megan's shots and meds and doing trach care and all that involves, while also getting Megan as much therapy as possible via telehealth.
Right. And in terms of my life before the stroke, I was a managing partner at a healthcare advertising agency, and we have 2 children, and at the time of the stroke they were 9 and 6, and so we had a really full, busy, robust life. And so all that kind of came to a grinding halt, as you can imagine, when the diagnosis occurred and when I was hospitalized.
Why don't you tell everyone about your recovery after the acute premature coming home phase?
Sure, sounds good. So I got home from the hospital in April of 2020, and since then I've been recovering at home. So at first I was doing PT, OT, speech therapy, all of those over Zoom because of COVID. And eventually everything became live once the pandemic was over. I also did acupuncture for several years. And I do yoga. And I work on handwriting. Because basically, the stroke left my right side, where I was doing all my handwriting.
She used to be a righty.
That's right. So left my right side, not so well off. And so I've learned to write with my left hand. And I also have learned to play the piano. I never played the piano before the stroke, but it's really good therapy for right hand.
You learned to read music and play the piano.
Correct, so, yes.
Kudos.
Oh, thank you.
You're welcome.
I could never read music beforehand, so I have learned to read music. I also do driving. So that is something I'm doing, which is a form of rehabilitation. But I've had to learn how to drive with my left foot because I wasn't really able to do that beforehand. And because my right side was so affected. And in addition to being right side with the driving, right foot, I also have a spitter knob that allows me to drive with my left hand. So I do that. I also had to learn how to go on the bus with my wheelchair, which I learned how to do. I also have been doing a clinical trial, which has been really exciting. So that involves a therapy where I am like basically putting something on my tongue, which hopefully will stimulate my brain to develop more neuroplasticity. So it's very interesting. So I did the clinical trial for 12 weeks, and I would say that it helped. It helped improve my balance, which is great. And in addition to that, I do a lot of other things which were recommended by my practitioners with regard to the driving. So I do blaze pods, I do Pop It, I do Nintendo Wii Tennis, and I do Nintendo Mario Kart to practice driving. So and Nick has rigged up a really great rig.
I have a spinner knob that I put on Megan's Mario Kart steering wheel, and I rewired the unit to have a left foot gas pedal as well. So we've done a bang up job of taking numerous kids' toys and turning them into therapeutic aids. So yeah, I'd say in general and specifically, you keep very busy, not just doing therapy. I think it's fair to say that the first 6 months to a year to 18 months out of the hospital, your identity was very much wrapped up in being a rehab patient. But
right.
as an outside observer, I would observe that since then you've done a fair bit of branching out and doing other
right.
stuff as well.
Yes, I have. And right now I'm actually studying to get my PhD in organizational development and change, and I would like to become an executive coach. And so at this point, I'm completely finished with my coursework, and I'm writing my dissertation, which is very exciting. And I'm also part of a book club, which is really fun and gets me out. And I do other things in the community as well. I do things with my children, which is really fun. And I'm part of a lot of trips. For instance, we just went to France, where we celebrated Nick's grandmother's 100th birthday, which was really fun. Nick, I really feel that I didn't do a very good job of knowing what happened during the Q phase of the experience. So maybe you could share a little bit about your thoughts and perspective about what HCPs should be doing, like what they did well during that point.
Sure. Well, you have a pretty good excuse for not remembering too much about your hospital stay.
That's true.
So we'll let you off the hook for that one. But first of all, I'll just say that we were interacting with some world-class physicians and healthcare providers, and everyone was super caring and helpful, and I think there are definitely people and instances that really stand out in my memory, and as having made their mark. I remember one nurse who bartered with another department on another floor to get Megan the right size boots to keep her feet just so while she was lying in bed for so long. I remember an incredibly caring respiratory therapist who watched over Megan constantly and even would come and visit her when she was on the rehab floor. I remember nurses who had their own little tips and tricks, like one who was able to get Megan's ICP reading to go down just by repositioning her just so, or another who could get her to stop sweating through some voodoo witch magic technique. So obviously all that speaks to just a very high level of care that these people brought to the bedside.
Really approaching things with empathy.
Exactly.
Right.
Well said.
So do you think there's anything that HCPs should not do or embrace differently?
I don't know, but again, so your memory is maybe a little fuzzy of the whole experience. My memory of the experience is more in flashbulbs, right? I remember these instances, and I can certainly remember instances where I had interactions with doctors that were, or various healthcare providers that were less than pleasant. And the one that stands out foremostly in my memory was when a doctor told me in no uncertain terms that you would have locked-in syndrome, that we would never speak again, or you would never eat any of my delicious cuisine again, or you'd never walk again. And obviously you're speaking, and obviously I can assure you that she's eating, and we're working on the walking thing too. So we're gonna prove them wrong on a number of points. But that was certainly a very hard thing for a loved one to hear at the time, and that definitely made an impression. And it does set the mind spiraling, kind of out of control, and yeah, just not an easy thing to hear, and it makes one start to like make plans based on that. And then it also makes a person, question whether every improvement that we saw in you, excuse me, from that point forward was real or just a flash in the pan. So yeah, that's the top one that sticks out in my mind. I think other examples would include, maybe we talk about you being rushed to be discharged home from rehab. Sure, that was due to COVID, but I think it also at one point you were kind of rushed to be discharged from the ICU to rehab. And again, I was told in no uncertain terms that you would not need a VP shunt. Well, guess what? Your head starts filling up with cerebrospinal fluid, and then you get discharged from rehab back to ICU to get the shunt put in, kind of like breaking the momentum that you had in your rehab. So clearly, no doctor has a crystal ball, no person knows everything, and we're all working off the best information that we have at the time. But it still kind of feels like a better sense of what is definite and what is probable would have been very, very helpful. Oh, and one last thing, and I know there's nothing we can really do about this, but the hourly neuro exams where every hour they'd come in and flick on the lights and yell at you to point the fingers and wiggle the toes and whatnot. Yeah, that was, in some countries that's considered torture.
They're disruptive.
Yeah. But I get it. What else are you going to do? So that's some of my feelings about, the more what went well, what didn't go well in the hospital part of things. Maybe you can talk a bit more about the longer term, post-hospital recovery phase. What do you think?
Sure. Well, in terms of what I think goes well, it's that, number one, it really does take a village. So I've had some amazing practitioners from so many walks of life. From my neurologist to my physiatrist to my physical therapist to my occupational therapist to my speech therapist. So many wonderful people. It's hard to be able to count. So that's really wonderful. I think if I had one piece of advice, it would be to think about getting people to more actively embrace uncertainty. Because that is something that I joke with very much.
Can you say a little bit more about that? What do you mean by that exactly?
Sure. Well, it's very difficult for me I always want to pin people down and ask them for a very specific time frame. When is this going to happen? When is that going to happen? And the truth is, you don't know. Not you, but no one knows. One doesn't know. And so embracing that philosophy is the best thing anyone can do. And that's a really difficult philosophy to embrace, but that's something that I think people should be doing.
Do you feel like whenever you'd ask that question in the past, people would dodge the question?
Yes, I do. And so I think if people just attack the question head on and say, I don't know, and you would be good to do a better job of embracing uncertainty, I think that would be helpful. Do you agree?
I do. And to put it a different way, I think one of the things that you and I have learned or implemented, that's really been a good way to think about your post-stroke recovery journey is measuring progress not from the point of view of what's been lost, but what's been regained.
Right.
So no one can tell you, okay, when you are going to, breathe on your own without, a trach again. But if we can, you know, track, like, all right, you did, this many reps with the, breathing device,
Right.
Today, and then twice as many next week or whatnot. Just like, I feel like there's hope.
There's things you can quantify.
100%.
Right. That makes sense.
Yeah. So if that was your message or advice to healthcare professionals, what advice would you give to patients and their families?
Let's see. I would say that the major thing is to measure everything and celebrate all the little milestones. Like, I think that even one step is really important. And I think that was something that I really needed to learn. Like, I wasn't the kind of person that was, like, very good at celebrating the small things that would happen. And that was not a good idea, because those things are really wonderful to be able to, like, bask in and enjoy. And if you just kind of move on to the next thing, you don't really get to appreciate them. And it's really good to be able to appreciate them.
I think it's also great that you have people, in your life who don't see you every day, when, because progress is hard to observe when, like, you're this close to it all the time. But it's always nice when you run into, a neighbor or a friend who's like, oh, you look so much better than you did last time I saw you.
Exactly. So my advice is to have people in your life that don't see you all the time.
On again, off again, friends.
To be able to really see the progress, because, like Nick said, the people that see you every day would not know that, or would not see that, wouldn't pick up on those things. So what about you? Do you have advice for people, for patients and caregivers?
Overall, I'd say the last bit of advice I'd leave you with is to recognize that, while the stroke happened to, my loved one, in this case you, the trauma happened to the entire family, and we all had to, deal with it and cope with it and work with it in our own way. I remember, as you said, the kids were 6 and 9 at the time. I remember our younger one, our son Ben, clinging to my leg and crying as I would leave to go to the hospital every day to see you. The kids were, bewildered, to say the least, and unsure how to cope with the mom-shaped
It was very hard to process it.
Yes, 100%. Nor was it easy. Required a ton of work and prep when we came to see you in the hospital the first time. The kids were coming into, a hospital, a scary place for children, and you were hooked up to
all
numerous
these machines,
tubes. Your
yes.
head was shaved. You were
right.
somewhat less, interactive than you used to be.
I wasn't the same person.
Correct.
That they were used to seeing.
Correct. This is true. But yeah, you were not the same. And yeah, the experience affected you. It affected them. It certainly affected me, and it's a long recovery process for us all. But we keep, nudging you along on your journey, and you do that to us as well. And like you said, it takes a village. So
right, and I'm very fortunate to have all three of you in my life.
Oh, shucks. Thanks, babe.
You're very welcome.
And finally, to all the caregivers out there, eat, sleep, definitely sleep. Write everything down, because brain fog is real. And ask for help, and accept help when it's offered to you.
Makes sense, yes. I agree with all those students said.
Should we say goodbye?
Bye-bye.